She walked into my clinic on a Tuesday morning complaining about forgetting where she parked her car. "It's just age, doctor," Margaret said with a nervous laugh. She was 67, sharp dresser, retired accountant, still did the crossword every morning. I ordered an MRI anyway. What we found changed everything. Small white spots scattered across her brain like breadcrumbs. Silent strokes, 5 of them. She'd had 5 strokes and never felt a thing. You've been told that strokes announce themselves with dramatic symptoms: slurred speech, drooping face, sudden paralysis. But here's what nobody tells you. The stroke that steals your future doesn't always knock you to the floor. Sometimes it whispers. Sometimes it happens while you're sleeping. Sometimes it masquerades as forgetfulness or just getting older. And by the time you notice something's wrong, you've already lost more brain tissue than you needed to. I'm Dr. Anderson, a cardiothoracic surgeon with 32 years of experience and over 2,400 surgeries behind me. I've held beating hearts in my hands. But the cases that haunt me aren't the ones that arrive by ambulance with sirens blaring. They're the ones like Margaret. The patients who walk in under their own power, apologizing for wasting my time, unaware that their brain has been under siege for months or years. The medical establishment has failed you on this. We've taught you to watch for the obvious, while the invisible does its damage. We've focused on the big catastrophic stroke, while silent strokes chip away at cognitive function, balance, and independence. Every silent stroke increases your risk of a major stroke by 300%. And the medical community has known about this for decades, but somehow forgot to make it a household conversation. I've watched families in waiting rooms trying to piece together when things changed. When did dad start having trouble with stairs? When did mom stop managing the checkbook? The answers are always the same. Gradually. So gradually nobody noticed, because silent strokes don't give you a warning. They accumulate like interest on a debt you didn't know you owed. After 60, your brain operates in a different world. The blood vessels that have served you perfectly for decades start to stiffen. Think of them like garden hoses left out through too many winters. The rubber gets brittle. The walls get rigid. The same pressure that used to flex and accommodate now causes micro tears and blockages. Your brain requires 20% of your body's oxygen, despite being only 2% of your body weight. When those stiffened vessels can't deliver, your neurons start dying. Not all at once, not dramatically, just steadily, in the background of your life. Here's the number that should concern you. 1 in 4 people over 65 has evidence of silent strokes on brain imaging. 1 in 4. That's not a rare condition. That's an epidemic hiding in plain sight. Your heart has been working for you every single minute of every day since before you were born. It doesn't take vacations. It doesn't call in sick. And when the vessels feeding your brain start to fail, your heart tries to compensate by pumping harder. But harder doesn't help if the pipes are blocked or brittle. Stay with me, because what I'm about to share with you could be the difference between catching this early and explaining to your children why you can't live alone anymore. The first sign is trouble with tasks you used to do automatically. I'm not talking about forgetting a name at a party. I'm talking about standing in your kitchen, the kitchen you've cooked in for 20 years, and suddenly you can't remember what comes after you crack the eggs. Or you're driving a familiar route and you miss your turn. Not because you were distracted, because the turn didn't register. Here's the mechanism your doctor probably hasn't explained. Silent strokes typically occur in the white matter of your brain, the communication highways between different brain regions. When these pathways get damaged, the different parts of your brain that used to coordinate seamlessly now have static on the line. Your memory might retrieve the recipe, but the signal to your motor cortex about what to do next gets dropped. It's not dementia. It's not Alzheimer's. It's infrastructure damage. The risk after 60 compounds because you likely have decades of micro damage already present. High blood pressure you didn't know you had in your 40s. Blood sugar that crept up in your 50s. Each insult to those vessels adds up. And unlike a major stroke that kills a large region of brain tissue all at once, silent strokes kill scattered neurons across multiple areas. This scattered damage is actually harder for your brain to root around. I had a patient named Robert, 69, who came in because his wife noticed he'd been putting the milk in the cupboard instead of the refrigerator. 3 times in 1 week. I'm just distracted, he insisted. The MRI showed 7 silent strokes, 7 separate incidents where blood flow stopped long enough to kill brain cells, but not long enough to cause obvious symptoms. He was still driving, still managing his investments, still completely unaware that his executive function was being dismantled. Write that down. If you're suddenly struggling with tasks that used to be automatic, that's not normal aging. That's your brain telling you it's not getting what it needs. Now, what can you do about it starting tonight? Get your blood pressure checked and actually know the number. Not, the doctor said it's fine. The actual number. After 60, you want it below 130 over 80. Every 10-point increase in systolic blood pressure increases your silent stroke risk by 28%. Home blood pressure monitors cost $30. The second sign is subtle changes in your gait or balance. You start holding the railing when you didn't used to. You feel unsteady when you turn your head quickly. Maybe you've tripped over nothing. You blame it on the uneven sidewalk or just being clumsy. But here's what's actually happening. The cerebellum and the basal ganglia, the parts of your brain that control coordination and smooth movement, are heavily dependent on constant blood supply. When silent strokes hit these areas, they disrupt the automatic balance adjustments your body makes thousands of times a day. You don't consciously think about balancing when you walk. Your brain does it in the background. But when the neurons responsible for that background processing are dying, the system starts to lag. After 60, you've also lost muscle mass and bone density, which means a fall that would have been nothing at 40 can put you in the hospital at 70. And here's the vicious cycle. Silent strokes increase fall risk. Falls increase head trauma risk. Head trauma accelerates cognitive decline. I remember Sarah, 72, who mentioned almost casually during a checkup that she'd started feeling wobbly when she got out of bed in the morning. It took about 30 seconds for the feeling to pass, so she didn't think much of it. Brain scans showed multiple small strokes in the posterior circulation. She was 3 months away from a major stroke. Here's the comment I want you to leave. How's your balance compared to 5 years ago? Be honest. The fix is not just balance exercises, though those help. You need to address what's causing the blood flow disruption. That means looking at your carotid arteries with a simple ultrasound. Those are the major highways delivering blood to your brain, and they can be 70% blocked without causing obvious symptoms. Starting tonight, add one thing. If you take aspirin, take it at night. Studies show aspirin taken at bedtime reduces early morning stroke risk by 40% compared to morning dosing. Before I give you the third sign, I need to tell you something. The pharmaceutical industry has made billions selling you statins and blood pressure medications, but they've systematically ignored the dietary changes that would prevent 60% of silent strokes because there's no patent on vegetables. I'm not saying medications don't help. I'm saying they're not the whole answer. The third sign is subtle personality changes or increased irritability. Your spouse says you're more impatient than you used to be. You snap at people over small things. You feel frustrated more easily. Maybe you've withdrawn from social activities you once enjoyed. Everyone assumes it's depression or just the stress of aging. But sometimes it's your frontal lobe dying one neuron at a time. The frontal lobe is your brain's executive suite. It controls impulse regulation, emotional control, social behavior, and complex decision-making. When silent strokes damage this area, they don't take away your ability to function. They just lower your threshold. Tasks that used to take effort but were manageable now feel overwhelming. Interactions that used to be easy now drain you. The patience you used to have evaporates. After 60, you're also dealing with reduced serotonin production, hormonal changes, and often chronic pain or sleep disruption, all of which affect mood significantly. So, when silent strokes add insult to injury by damaging the emotional regulation centers, the personality changes can be profound, but still subtle enough that everyone blames normal aging instead of vascular damage that can be treated. I treated a man named James, 64, whose daughter brought him in because he'd become mean. That was her word, mean. He'd always been a gentleman, patient with his grandchildren, kind to strangers. Over about 18 months, he'd become short-tempered, critical, sometimes cruel in ways that shocked his family. They thought it was early-stage dementia. It wasn't. It was 3 silent strokes in the frontal lobe that had damaged his ability to regulate emotional responses. The man everyone knew was still in there. His brain just couldn't access him anymore. What can you do? Monitor your homocysteine levels. This is a blood marker most doctors don't check routinely, but elevated homocysteine damages blood vessel walls and increases stroke risk by 200%. It's fixable with B vitamins, specifically B6, B12, and folate. After 60, your ability to absorb B12 from food decreases dramatically, which means supplementation isn't optional, it's necessary. Get your level checked. If it's above 10, you're in the danger zone. Optimal is below 8. The fourth sign is difficulty with vision or visual processing. You're having trouble reading, even with your glasses updated. You can't judge distances as well as you used to, which makes parking harder or reaching for objects less accurate. Maybe you've noticed blind spots that come and go, or your eyes feel like they're not working together properly. The visual cortex at the back of your brain and the processing centers throughout your brain are oxygen-hungry tissues. When silent strokes interrupt blood flow to these areas, your vision doesn't go black like you'd expect from a major stroke. Instead, you get these subtle disruptions in processing. The eyes themselves are fine. The signal just isn't getting through clearly. After 60, you're also dealing with normal age-related changes in the lens, the retina, and the optic nerve. But here's the distinction. Those changes are gradual and consistent. Silent stroke-related visual problems tend to be more variable. Good days and bad days, clear moments and foggy moments. That variability is the clue that something vascular is happening. I had a patient, Dorothy, 71, who complained that reading made her tired now. She'd always been a voracious reader. 3 books a week minimum, but over 6 months, she'd dropped to barely finishing one. She blamed her eyes. The ophthalmologist said her eyes were fine for her age. Brain imaging showed silent strokes in the visual processing areas. It wasn't her eyes that were tired. It was the parts of her brain that interpreted what her eyes saw. She could see the words. She just couldn't process them efficiently anymore. Starting tonight, get your eyes checked by an ophthalmologist, not an optometrist, and specifically ask them to look for signs of vascular insufficiency in the retina. The blood vessels in your retina are the only blood vessels in your body that can be directly observed without cutting you open. Narrowing, hemorrhages, or cotton wool spots in the retina often predict what's happening in your brain. And add omega-3 fatty acids, minimum 1,000 micrograms of combined EPA and DHA daily. Omega-3s reduce inflammation in blood vessel walls and improve blood flow. The studies are clear. Most people over 60 are severely deficient. The 5th sign is urinary urgency or incontinence that develops relatively suddenly. You find yourself needing the bathroom more frequently. Maybe you've had a couple of close calls that embarrassed you. You assume it's prostate trouble if you're a man, or pelvic floor issues if you're a woman. And sometimes, that's exactly what it is. But sometimes, it's silent strokes in the areas of your brain that control bladder function. Your brain regulates when your bladder empties through a complex pathway involving the frontal lobe, the pons, and the spinal cord. Silent strokes that damage any point in this pathway can cause what's called neurogenic bladder. The bladder itself is healthy. The signal coordination is broken. This type of incontinence often comes with urgency, the sudden overwhelming need to go that gives you almost no warning time. After 60, you've got multiple systems declining simultaneously. Hormonal changes affect tissue elasticity. Medications like diuretics or blood pressure drugs increase urine production. Prostate enlargement in men and pelvic floor weakness in women are real factors. But when bladder problems appear suddenly, rather than gradually, or when they're accompanied by any of the other signs we've discussed, you need to consider vascular causes. I worked with a woman named Helen, 68, who'd started wearing pads because she couldn't always make it to the bathroom in time. She was mortified, too embarrassed to mention it to her family, too ashamed to seek help initially. When she finally came in, brain imaging showed silent strokes in the frontal regions that control bladder signals. The problem wasn't her bladder. It was the communication line between her brain and her bladder. She'd been suffering for 9 months, thinking it was just an inevitable part of aging. Here's your action step. If you're experiencing bladder changes, get a post-void residual ultrasound to measure how much urine stays in your bladder after you urinate. If you're retaining more than 100 millimol, that's a neurological signaling problem, not a mechanical bladder problem. And hydration matters more than you think. I know it seems counterintuitive, but dehydration makes your urine more concentrated, which irritates the bladder and makes urgency worse. You also need adequate hydration for proper blood flow to the brain. 8 glasses a day minimum. Not coffee, not soda, water. The 6th sign is slowed processing speed or delayed responses in conversation. People have to repeat things to you more often. You need a little more time to answer questions. You find yourself losing track of conversations when there's background noise or multiple people talking. Everyone calls it senior moments. You laugh it off, but inside, you're worried. Processing speed is one of the most sensitive indicators of white matter damage from silent strokes. It's not that you can't understand or respond. It's that the speed at which information moves through your brain has slowed down. Think of it like an internet connection, degrading from high speed to dial-up. The information still gets through, but the lag time increases. After 60, some processing slowdown is normal, as myelin sheaths on your neurons thin and nerve conduction slows. But here's the critical difference. Normal aging slowdown is steady and proportional. Silent stroke slowdown often comes in steps. You'll notice a period where things seem harder, then you adapt and it stabilizes. Then another drop. Those stepwise declines are the signature of vascular incidence, not gradual aging. I remember Michael, 73, whose son brought him in saying, "Dad isn't dad anymore." Michael had been an engineer, sharp as a tack, quick-witted, always the fastest in the room. Over about 2 years, he'd slowed considerably. Still competent, still functional, just slower. The family had adapted. Conversations took longer. Decisions took more time. They thought it was normal. The imaging showed over a dozen silent strokes scattered through the white matter. Each one had knocked out a few more connections, and the cumulative effect was unmistakable once you knew what to look for. What should you do starting tonight? Challenge your processing speed deliberately. Do timed crossword puzzles or Sudoku, not for fun, but to establish a baseline. If you notice your times increasing significantly over a 3-month period, that's actionable information. And here's the intervention nobody talks about: lion's mane mushroom extract. The research is preliminary but compelling. Lion's mane promotes nerve growth factor, which helps repair and maintain myelin sheaths. 500 milligram twice daily. It won't reverse stroke damage, but it supports the brain's repair mechanisms. I need to tell you something I've never said from behind a surgical mask. I'm standing in an operating room, looking at a heart that should have failed years ago, but kept beating because it didn't know how to quit. And I'm wondering how many of those families in the waiting room spent years watching their loved one decline and just accepted it. How many small changes did they adapt to? How many warning signs did they normalize? The silent stroke patients haunt me because they come in apologizing. Apologizing for wasting my time. Apologizing for getting old. Apologizing for their brain betraying them when nobody ever told them what to watch for or how to fight back. I've held beating hearts in my hands, and I've seen what happens when we catch things early versus when we wait until the damage is catastrophic. The difference is measured in years of independence, in memories made versus memories lost, in dignity maintained versus dignity surrendered. I think about the ordinary habits that brought them to my office. The blood pressure they didn't monitor because they felt fine. The diet heavy in processed foods and light on vegetables because it was convenient. The refusal to exercise because they were tired, not realizing that the fatigue was a symptom of the problem, not a reason to avoid the solution. And the medical system that taught them to wait for symptoms dramatic enough to warrant emergency care while the silent damage accumulated unchecked. Margaret, the woman I told you about at the beginning, the one who thought she was just forgetful, she made changes, all of them. She got her blood pressure to 118/72 and kept it there. She added omega-3s and B vitamins. She started monitoring her processing speed. She had a carotid ultrasound that showed 40% stenosis on the left side, which we addressed before it became 70%. 6 months later, her repeat MRI showed no new strokes. The existing damage didn't reverse, but we stopped the progression. She told me something I think about often. Nobody ever explained that I had options. They told me about stroke symptoms to watch for, like I was supposed to wait for the emergency. Nobody told me I could prevent it while I still felt fine. That's the conversation I'm trying to have with you right now. You have options. It is never too late to protect what remains and optimize what you still have. Here's what I need you to remember. 6 signs. Automatic tasks becoming difficult. Balance or gait changes. Personality shifts or irritability. Visual processing problems, sudden bladder urgency, and slowed thinking or response time. Any one of these warrants investigation. 2 or more together is a pattern you cannot ignore. Write this in the comments. Which of these 6 signs have you noticed in yourself or someone you love? Be specific. Your experience might be the wake-up call someone else needs. Share this information with someone over 60 who needs it. Not everyone watches these videos. Not everyone knows to ask these questions. You might save someone from years of preventable decline. And if this information matters to you, subscribe so you don't miss what's coming next, because we're just getting started on the conversations your doctor isn't having with you. I'm not your physician. I can't diagnose or treat you through a screen. What I've shared here is educational information based on decades of surgical and clinical experience. Every person's situation is different. Risk factors vary. Medical histories matter. Before you make changes to medications, supplements, or treatment plans, talk to a healthcare provider who knows your full picture. This is information to start a conversation, not to replace one. But start that conversation. Your brain can't wait for you to feel sick before you take action. By then, silent strokes have already taken more than you can afford to lose.